Welcome to this recording of the webinar and launch of the Practical Guide to Impact Assessments in Microinsurance, which took place on the 7th of May. To have impact is the reason why we invest time and money in microinsurance, but the assumptions of what this impact should be are often vague or not backed up by evidence. Would it not be important to be sure that these assumptions are correct?
This is why a systematic approach toward impact assessments, honoring certain research standards and norms, is crucial if we want to make sure interventions are meaningful and future ones built on the lessons learned from the past. To make this happen, the Impact Working Group of the Microinsurance Network, under the leadership of Ralf Rademacher, developed a framework to provide guidance for impact research with the aim to bring together the individual results so that a big picture emerges of how theory translates into practice. The framework has now been published as the Practical Guide to Impact Assessments in Microinsurance. More than 20 experts have come together and contributed in the different areas of their expertise. Comments from more than 15 peer reviewers have been discussed and addressed. Without all these people, the book would not have taken shape and become as concise as it is today. Here I would like to thank the German government, GIZ, DILO, 3IA, and also the network's key funder, the Luxembourg government, for their important investment and support throughout this process. This guide has been published by the Microinsurance Academy and the Microinsurance Network on behalf of the Impact Working Group, and when I look at the result, there is no doubt that the time and the energy that the MIA and network staff have put in this project was well worth it. The stamina and dedication to this project that especially the editors Ralf and Katja and the network's communication coordinator Annalisa demonstrated until today and beyond, I guess, deserves greatest recognition and admiration. The structure of the book follows the flow of research projects from understanding the subject matter, look at different methods, selecting the appropriate one or several ones, to planning, conducting research, and to finally drawing conclusions and, very importantly, sharing the results. As we had announced in our invitation, we will be selecting 10 participants to who we will send the book, which will be ready end of May. So the winners will be notified after this webinar by email. Maybe to the next slide, I just can mention that I'm afraid to say, in line with the proposed framework, of course, that the publication of the book is not the end, but only a beginning. It's an important step towards provoking improvements and get the framework adopted. So the webinar is an important piece of this. And I'm honored that Ralf and some of the authors have agreed to discuss the importance of impact assessments and provide concrete tips on how to design and carry out high-quality evaluations in microinsurance. We are going first to discuss what impact assessments are, explore how to conduct them, focusing on experimental design, hear about the top 5 tips for setting up evaluations, learn from a case study in rural India, and then conclude on what's next. Just before I hand over to the authors, I would like to remind some of the participants that we will have a Q&A session at the end of the presentations. But you can already use the question function on the right-hand side to send in your question, which we will then compile and address. Or, of course, during the session, you can raise your hand and answer your question. Ask your question, sorry. During the presentations, we will mute everyone except for the speaker to make sure that there is no ground noise interrupting the discussions and presentations. So, without further ado, I would like to hand over to Ralf Rademacher, who is the Deputy Chairman of the Microinsurance Academy, and he will explore why impact assessment in microinsurance is important.
Thank you, Veronique. And before I start the presentation, I would also like to take the opportunity to thank from MIA side, particularly the Microinsurance Network Secretariat and the staff there for the great support in getting this book published, and also the other contributors and partners, the authors, in making this publication become reality. Thank you very much for that from my side as well. So what I'm going to speak about is why do we need impact assessments in microinsurance? And next slide. On the first slide, the first question is actually, what is impact? An impact is a change in the economic or social situation of individuals, households, or communities, which is attributable to the presence of insurance. These changes can not only affect the insured, but also can affect the uninsured. They can be positive or negative, and they can happen before or after an insured event is happening. For example, a study recently conducted in Pakistan has shown that the presence of insurance or having insurance can reduce child labor. Impact can materialize at different levels, and the micro, meso, or macro levels are not only within the insured household. For instance, in a larger health insurance intervention, the more steady flow of funds can improve the quality of healthcare providers because of that, of the presence of insurance. This, of course, would not only affect the insured, it would also benefit the uninsured in a positive way. Next one. So what do we know about the impact of microinsurance? To date, most studies covered health insurance. So we do know most about the impact of micro health insurance. There are quite a number of studies underway which also look at a number of other risks which are covered by microinsurance, and some of them recently also came out. The strongest evidence exists on the following. First, we do know that microinsurance creates better access to health care. There are numerous studies which have been conducted on that topic in very different contexts, so we can be quite confident in saying people having micro health insurance would usually get better access to health care. Furthermore, microinsurance, as insurance tends to, also unfolds positive effects on financial protection of the insured households. There are quite a number of studies which have shown that microinsurance on health reduces the out-of-pocket spending by households which have been covered in insurance. Furthermore, insurance can also lead to a reduction in asset sales and indebtedness of covered households. There are some studies, still few though, which show that insurance can have productivity enhancing effects. The study conducted in China, for instance, has shown that people or households having insurance have made higher investment in crossbred pigs. In Ghana, a study has shown that farmers covered with insurance have made higher investment in agricultural input. All of that likely to lead to higher incomes in the future. There are quite a number of knowledge gaps. Next slide, please. And we need more detailed understanding. Insurance can unfold quite a myriad of impacts, and most studies so far focus on a number of indicators, but not on too many. So we need to investigate more aspects of possible impact of microinsurance. We also need to look at more risks, as so far most studies have looked at health insurance, as mentioned before. For some of the studies, we do have evidence in a certain context. Evidence that it provides a positive impact on none, but we would need to actually see whether this is also true for a different context. So repeat the same study or a similar study in a different context to see whether an impact observed is context specific or we can generalize an insight. It would also be interesting to compare the impact of different microinsurance interventions or of microinsurance and alternative interventions of risk protection, for instance. This would give us a good insight into the efficiency of microinsurance. Next slide. So impact describes what insurance can do for the insured. And we shouldn't forget, insurance is not an end in itself. If people experience positive impact, they want more insurance. And that's a very useful insight to know whether a program is good or not, even for private insurers who can try to create a competitive edge over their competitors. But it's also important to know for donors and governments whether their programs achieve what they were supposed to achieve. And it can guide future donor and government decisions on how to make programs work. So the detailed knowledge on impact can help develop better program designs, which can yield better development outcomes. And with the microinsurance sector growing quickly and a lot of money being invested there, the understanding of how to achieve maximum impact therefore ensures that the sector is developing in the right direction. Thank you very much.
Thank you, Rolf, for this very clear introduction into why impact assessments are important. Again, keep all your questions for the Q&A session, and if you want to shoot them off already, use the questions box on your right-hand side. Now I would like to hand over to Tomoko Harigai, who is a doctoral student at the Howard Kennedy School of Government. She contributed an article on experimental design together with Dean Carlan from Yale University.
Thank you, Veronique. Okay, so there are many ways to assess program impact, but today I'm giving you an overview of one type of assessment method, experimental designs, which are often considered gold standard. Okay. So the main objective of an impact assessment is to measure how a microinsurance scheme affects the lives of the target beneficiaries. For example, there are many countries now that are trying to achieve universal health insurance coverage through various public and private insurance schemes. And they might be interested in the question, does health insurance coverage improve health status among the poor? And if you are designing an insurance scheme for farmers, you might be interested in the question, does access to crop or rainfall insurance increase income of farming households? Which program works better? How can we improve program designs? And in all of these impact assessment questions, you are implicitly looking for the causal effect. So there is a program, and there are program objectives, or the theory about how the program should work or which outcomes the program should affect. The goal of an impact assessment is to isolate this link, the changes that are caused by a specific microinsurance scheme and not by other things in the environment. So let's think about an ideal impact assessment. Suppose that you're introducing a microinsurance scheme in 100 rural villages somewhere, and when you implement the program, you're able to observe how these villages change over time. After a year, you might observe that the households in the sample villages have higher income than they did a year ago. But this change in income over time doesn't really capture impact of the program. In an ideal world, you want to compare that observed change to an alternative world in which the same 100 communities did not receive the microinsurance scheme in that same year. And in this alternative world without microinsurance, let's say the average income of the sample villages decreased over that same year, then you can say, yes, this insurance program had a positive effect because nothing was different between these two worlds except the presence of microinsurance. On the other hand, if the average income in the alternative world also increased over that same year, then you would know that the insurance scheme didn't really have much of an effect and that the increase in income in the actual world that you observed was caused by something else. And we call the concept of this alternative world a counterfactual. And obviously, this ideal impact assessment could never take place because we can't observe the alternative world. So the key to a good impact assessment becomes finding a good counterfactual or comparison group that almost looks like an alternative world. But unfortunately, it turns out that finding a comparison group that looks almost like an alternative world is not so easy. So let's think about the comparison groups that are commonly used in evaluations. Non-participants versus participants of an insurance program, or the outcomes of the program site versus those in the neighboring provinces and districts, or simply before versus after the program introduction. The problem of these methods is that these comparison groups are inherently different from the intervention group. So for example, non-participants chose not to sign up for the program. So maybe they are wealthier, maybe they have other means to mitigate risks. Similarly, the program site is typically chosen for specific reasons, like targeting the poorest districts or politically stable areas, and they could be very different from neighboring districts. And these differences are problematic because you can no longer be sure that the difference in income or well-being that you observe between the two groups is caused by the insurance scheme itself. It could have been caused by something else that was different between the two groups to start with. And the reason that we like experimental design is that it solves this problem by using a randomization to create intervention and comparison groups. So it's a statistical procedure that creates groups with balanced characteristics. And in other words, randomization gives you an appropriate counterfactual world that tells you what would have happened to the program participants if they didn't receive the microinsurance scheme. So in the chapter after the discussion of the conceptual framework, we also talk about practical and logistical issues in designing and implementing randomized evaluations. And I don't have time to go through them in detail today, but here are some topics covered in the chapter. We talk about resource and capacity constraints in setting up an evaluation. Fairness concerns are often raised with randomized evaluations, or the timing of various evaluation activities and when things should happen, when you should start thinking about designing an evaluation. And many of these practical concerns can be actually addressed by the design of an evaluation. So we talk about different, there are various randomization methods, and some methods could even help you avoid having to deny access to the program in a control group. So just to wrap up, I think that there is this perception out there that impact assessment is very expensive, very complicated, and too demanding. But our hope is that this chapter not just gives you a conceptual overview, but also kind of a sense on when it's appropriate to evaluate, how you could make it feasible, and talk through options and flexibility that you have when designing a randomized evaluation. I think I'm out of time, so I'll stop here.
Thank you, Tomoko. This was really clear, and I think it kind of provides some good pointers on when randomized design can be used and how. Again, I think there is much more information in more detail in the book about this. I now would like to introduce you to Divya Parmar, Research Officer at the London School of Economics. She contributed a chapter together with Manuela Di Allegri, and they wrote on operationalizing impact evaluations, and she's going now to talk about top 5 practical tips for setting up an impact evaluation.
Yeah, thanks, Veronique, for the introduction. I shall now take forward the discussion where Tomoko finished and focus on some of the key points that need to be considered when translating the theory of impact evaluation into practical fieldwork. As said, this chapter was written with Manuela Di Allegri, and it draws basically on our experience of evaluating microinsurance programs in low and middle income countries. Next slide. In this chapter, we discuss 5 aspects of conducting an impact evaluation. First, how the selection of the research design depends upon field realities. Second, what resources are needed to conduct impact evaluations. Third, we address some of the practical considerations around sample size, tool development, data collection, and analysis. And fourth, we review some of the ethical procedures that need to be followed. And finally, how research impact can be maximized. These 5 sections are described in detail in the book, and today I have selected just one practical tip from each of these sections. Since I have just over 5 minutes, I have made the presentation really short, but you can have and you can find more examples in the book. Next slide. Selecting an appropriate impact evaluation. Although theoretically randomization is often regarded as the best method to establish causality, it may not always be the most feasible. Research designs often depend also on how the microinsurance program is launched. And this brings me to my first tip, that is to start planning the impact evaluation as early as possible and ideally during the conceptualization of the scheme. So if the research team is engaged at the early stage, they can guide the implementers on the best way to launch the program. So generally microinsurance programs tend to start small. There's a small team that generally drives the initiative, and they may plan a phased rollout of the program. So if the research team is involved at this stage, they can actually point out that if the rollout is randomized to villages or district, then the impact of the microinsurance can be assessed more accurately. Early discussion with the implementers also gives the researcher an opportunity to collect suitable baseline data, which is also critical in assessing impact. However, speaking from experience, the impact evaluation is often commissioned once the program is already underway, and this greatly restricts the options available to the research team. Second tip is around resource consumption. Any impact evaluation study is as good as the quality of the data. In a resource-poor setting, the quality of data is not always great for a number of reasons, one of which is that the data collectors are not suitably trained. This leads to a large number of human errors and inconsistencies in the data. We strongly advise to use digital devices for data collection that can substantially reduce errors, and to spend more time in selecting and in training data collectors, especially if there are qualitative research components as well. From my experience, actually using digital devices are not too expensive. We find that researchers can recover the cost over 2 rounds of data collections for about, say, 1,200 households. This is because using digital devices can significantly reduce the cost of data entry and checks. Third tip is around sampling. So different evaluation designs have different resource requirements. Experimental design that rely on randomization generally require constant supervision to ensure that randomization is happening properly. Quasi-experimental design, on the other hand, require relatively less supervision, but they require technical expertise, especially with regard to sampling and analysis. So this leads to my third tip, that is to hire an experienced statistician to help in sampling, especially if you are using a quasi-experimental design. Next slide. The fourth tip is with regard to ethical considerations. Even after the ethical boards have granted permission to conduct the impact evaluation, the researcher should engage with the local microinsurance team so that the design is appropriate for the community. For example, in one of the research projects that we were working with, we got, so the project involved long and repeated interviews with household members, and we were actually advised by the local partner that the community leaders have requested that a token gift be given to the respondents for their time. And we noticed that by including a gift, this really improved the support we got from the community. It's also better to engage with community leaders before you start data collection. This is not only to get permissions, but also to get their buy-in for continuous support throughout the study. For this to happen, they must see the value of the impact evaluation and also the value of the microinsurance program. Last, the tip is with regard to dialogue with stakeholders and knowledge transfer. So we would all agree that the ultimate aim of the impact evaluation is not only to measure the impact of the microinsurance program, but also to provide evidence to make policy decisions. It is important to realize that impact evaluations do not happen in socio-political vacuums. The research team needs to make efforts to engage with several politically relevant stakeholders beyond the ones who might have commissioned the evaluation. This may include national and local policymakers, donors, NGOs, and of course the community. And to maximize impact, they should be engaged as early as possible. One of the good examples that I have observed is with a research center we worked in Burkina Faso. So they have a great process of engaging with the community. They regularly hold meets with community leaders and traditional practitioners to ensure that the content of the research activity is properly communicated and concerns of the community are addressed. Next slide. So in conclusion, I would like to highlight that each setting is unique. Next slide. So I would like to, this is my last slide, and I just wanted to highlight that each setting is unique and presents its own challenges and opportunities. So a good researcher is the one who is flexible in maneuvering these realities to operationalize an impact evaluation. Thank you.
Thank you very much. Part of your presentation already addressed some of the questions we got in, as particular with regard, are there examples on how impact results were used effectively? And you highlighted that it's not enough just to publish the results and hand the report over to the donor, but to really make sure that there are policy implications. So we are definitely going to come back to this in the Q&A session. We will have a case study now, and I'm glad to introduce you to Karuna Krishnaswamy, development consultant, who will talk about an evaluation of an outpatient health insurance product in rural India.